Hey, this is Shadaris, and I'm RN and BSN student, and I'm going to perform my head, nose, eyes, ears, and mouth, neck assessment on my mom. Say hey.
Hi.
Okay, and we're going to perform this assessment. Here we go. Alright, hi, I'm Shadaris. I'll be your nurse today. Can you tell me your name and date of birth?
My name is Elizabeth Phillips. My date of birth is August 25th, 1952.
Okay, first I'm going to start with her head. I'm going to look at her skin, check her skin. It's appropriate for her color, appropriate for her race, excuse me. She don't have any lesions or cuts, no swelling noted. She's not making any involuntary movements. She's not staring or gazing off any place, anywhere inappropriately. Let's see. There's no swelling, no cuts, no lesions. Now I'm going to look at her scalp. Let me know if I'm hurting you or there's any tenderness. As I'm spreading her hair, I notice there's not any lesions anywhere. There's no tenderness anywhere. I'm not feeling any lumps and bumps in her scalp. Her hair is appropriate. It's coarse and wavy. Okay, so now while I'm here, I'm also going to check her temporal artery, which would be right here. Right as I'm feeling and assessing the temporal artery, I don't feel any bulgingness or any pulsations. It's not palpable. Any pain or tenderness here?
No.
Okay, no pain or tenderness complaints from the patient. Okay, now I'm also going to assess the patient's sinuses while I'm here. While I'm assessing her face, I'm going to do the frontal sinuses. Any pain or tenderness?
No.
Pain or tenderness here?
No.
No. All right, now let's do the maxillary. I'm going to put my fingers under here. Any pain or tenderness?
No.
Okay. Now, also, we're going to look at her eyes. Okay? We're going to look at her eyebrows. You see her eyebrows? They're even. The hair in her eyebrows are even. They're even. No cuts or lesions. Her eyelashes are evenly distributed. We also going to look at her conjunctiva and her pupil. We're going to look at the iris also. Her sclera first is white. The conjunctiva is pink bilaterally. Her iris is appropriate, is brown and appropriate. Like I said, the sclera is white bilaterally. The conjunctiva is pink bilaterally. We're going to look at the ducts in her eyes, the lacrimal ducts, which are intact. The punctina is intact bilaterally. Okay. Now we're also going to check her eyes, see if they are reactant to light. So I'm going to cut the light off and use my pen light and see if I can get her pupils to constrict. Okay, give her eyes some time to get accommodated to the darkness, because her eyes will naturally dilate once it's dark. So I'm going to do this for time's sake, only one eye. Excuse me, and I'm going to do the left eye. Okay, ready? Look straight for me. Okay, you're going to see a bright light coming to your eyes. Okay. Once more, just to make sure. Okay. So that was her left eye. Her left pupil constricted, with the right pupil constitutively constricting also. So her pupils are equal, round, reactant to light. Okay? So now that we did her eyes, which also refers to the cranial nerve, to the optic nerve, now we're going to go and look at her. Well, before I go to her nose, I want to ask her can you smile for me? And can you puff out your cheeks? Okay, so her facial nerve is also intact. So now we're gonna look at her nose. Okay.
Okay.
Now we're looking at her nose. It's symmetrical. The nares are symmetrical. Can you hold your head back for me? I'm gonna shine my light into each nair, and I'm looking at each nair, and I can see the turbinates in the nair, and they are appropriate. There's no drainage on the turbinates. Any tenderness?
No.
No tenderness. I'm gonna check for patency of her nose. So if you mind holding one nostril and blowing out, doing the other one. Okay, so her nostril, there's patency in her nostrils. Let's see. Also, now we're gonna look at her mouth. Okay, now I'm looking at the verminal area of her mouth, which is the border of her mouth, top lip. I don't see any vesicles or ulcers anywhere. I don't see any breaks in skin. The color of her lip is appropriate for her skin, which also matches the skin on her face. I'm looking at her bottom lip, and it's appropriate. It matches. I'm gonna pull down on her bottom lip and look at her gums. Her gums, there's no receding, no cuts, no ulcers, no lesions, of her teeth. Okay, we're gonna pull up on the top lip, and there's no receding in the gums. Everything's intact. No cuts or bruises. Now I'm going to ask her to open your mouth. Stick out your tongue. Okay. Now I'm looking in her mouth, and don't hold your head back, but hold it forward. Okay. Got your tongue stick out. Okay. I'm looking in her mouth. I don't see any cuts or lesions anywhere. The uvula is midline and it's intact. Lift up your tongue for me. Okay. As you can see, the frenulum is intact also, and then we have the Wharton ducts noted bilaterally on each side of the tongue. She does have a bridge at the bottom of her tongue, metal bridge. That's noted. Okay, thank you. Now, we're going to assess her ears. Can you turn to the side for me? We're going to assess her ears. Okay. So when assessing the ears, I'm going to inspect the ears. I'm going to look. She don't have any cuts or ulcers, anything, lumps or bruises bilaterally to her ears. I'm going to touch her ears. Any pain or tenderness?
No.
No pain or tenderness while I'm touching her ears. Now I'm going to look at her. I'm going to assess her tragus right here, and I'm rubbing the tragus. You have any pain or tenderness right here?
No.
No? Okay, good. All right, now I'm going to look in her ear, see if I see anything, any ulcers, any drainage or anything. Okay? Don't see any drainage. Bilaterally, okay? All right, now I'm also going to perform a whisper test, okay? I'm going to cover my mouth. She's going to cover a portion of her ear, one side of her ear. I'm going to cover my mouth, and I'm going to repeat a word, say a word, and see if she can hear it, okay? And she's covering her left ear. Okay, so I'm on this side. I'm going to, I'm far distant away from her, and I'm going to repeat a word.
99.
Okay, so the word was 99, and she got it correct. Okay. Now we're going to go back again. I'm looking at her mouth again. I need to look at her, see if I can see her tonsils. Okay. Tonsils are intact. 1+. And now I'm going to look, we're going to assess her neck. I'm looking at the neck. Hold your head back, hon. Seeing if it's midline. The trachea is midline. It is. No deviations noted in the trachea. Okay. Can you swallow for me? Good. All right. In pain?
No.
No. No nodules. No nothing palpable. Now I'm going to check for her thyroid gland. And I find it best for me to assess her thyroid gland backwards. And I'm going to feel. All right, can you swallow for me?
Mm-hmm.
Okay. Thyroid gland is non-palpable, but I just felt it move. But it's non-palpable. No pain or tenderness when doing that.
Mm-hmm.
Okay, good. No pain, no tenderness. Okay. So now what we're gonna do, lastly, is assess the lymph nodes. Okay, and how we're gonna do that is I'm gonna have her to turn to the side. Thank you kindly. And so we're gonna assess the lymph nodes. We're gonna first start with the pre-auricle lymph node, which is right here at the tragus, right here. I'm assessing it. Any pain or tenderness?
No.
Then we're gonna go to the posterior arterial node, which is behind the ear, right here, next to the mandibular. Mm-hmm. Okay, you feel anything? Tenderness, pain?
No. Mm-hmm.
No? Okay. Now we're going to go to the occipital lobe, which is right here behind. I'll show you. You can see my hand. Right here, the occipital lymph node. Any pain or tenderness?
No.
Okay. And now we're going to go to the tonsilliary node. Right here, do you feel anything?
No.
No pain, tenderness? Okay. Now we're going to go to the submandibular node, which would be for her right here at the jawbone. So, palpating. Do you feel anything, tenderness?
No.
Okay. And submental, which is only one, right here. So you can see my hand right here. Any pain or tenderness?
No.
Okay. And then we have the interior cervical, which would be, hold your head straight, right here. Wait, move my hand out of the way. Which would be right here. Any pain or tenderness?
No.
No. All right, then we have the posterior cervical, which would be right here. Pain or tenderness noted?
No.
Okay. Then we got the supraclavicular. The supraclavicular node, which is at the clavicle up here. Let me get around so you can see me. Which is at the clavicle right here. Any pain or tenderness?
No.
Okay. All right, turn around. I'm also gonna check her transmandibular joint, which is right here. Actually, to open and close her. Can't see her. I'm asking to open and close your mouth. Open and close your mouth for me. Okay. Any pain?
No.
All right. That's it. We finished the head assessment. I hope everything was covered. All right. Thank you.